Normal. I mean, there was nothing like an after effect or something. I went through the day, same routine, same things, and felt normal. Ito, itchy lang, but that's it. Parang ganun. But nothing like significant. She was excited to see what will happen after the treatment, and I told her about yung how it would really help bring back growth sa hair ko. So we were both excited to see kasi it will take like 3 sessions so to see the result after. Excited, kasi I noticed nga in the first month yun, di ba, na I noticed some growth. That my hair felt thicker and less hair fall. Because before I would experience like during sleep, that when I wake up or when I just brush my hair in my head, I would notice some hair that would fall off. But now, after a month of going, experiencing treatment after, yan, parang mas thicker siya. Longer nga parang feeling ko kailangan magpagupit kasi parang hindi ko alam parang tumubo yung accelerate yung hair growth somewhat. Kasi before, I've noticed na my hair growth would be longer. Because they were able to analyze my hair from last session. So I think they wanted to focus more on the crown area part. So I'm excited to see more development on this area naman.
It depends on the hair loss that is being treated. But this one is androgenic alopecia, so the most common hair loss that I encounter in my practice. With PRP treatment of hair loss, androgenic alopecia, whatever the cause of hair loss, patients observe improvement after 2 weeks of treatment, after 4 months, so they see immediate result from PRP treatment. After the PRP treatment, okay, we just ask the patient to shampoo the following day because we also perform microneedling. We want the growth factors to work to affect the growth of the hair. Definitely, again, it depends on what hair loss condition is being treated, So in this case, with androgenic alopecia, we know that it's the hormone testosterone and its metabolite dihydrotestosterone affects the hair follicles. With PRP, it affects the hair cycle, particularly the initiation and extension of the anagen phase. The problem is still there, so there is more or better result to expect if we combine it with the FDA-approved topical treatment.
More tolerable the procedure this time. I think yung anesthesia really helped. Okay siya. Doc explained it well. It's faster, I think, this time. Yeah, and then what will be the effect of the PRP on, especially on my condition. Yeah. And then she explained it well naman, and she told me that it's really to stimulate the hair growth. And excited to see development. Kasi every time we would take pictures of the parts that were affected. Sa akin kasi it's more of the frontal and crown area. So I'm excited to see any development on those areas. Well, definitely. Kasi for men, like I said, it's sobrang we take care of ourselves like less, It's just really minimal, you know, we don't go to dermas as often, you know, as women will probably do. But for us, hair is like your crowning glory, you know? So, treatment for your hair, especially if it's thinning or losing hair, it can boost your confidence, you know, especially for work or around the kids or being out in public. So definitely, I would recommend it. It will help really boost your confidence as a man.
Yes, I believe JJ has been more confident with himself and his hair. He used to always touch his hair before and always look at the mirror, but now I would always see him be more confident even with around the kids, and he holds his hair less. So I know it's really doing good for him.